uh, infiltrated. Some of these dressings will come up easier than others. These kind of tegaderms, you can pull them from the side and loosen them. And these are like really cheap ones and they tear. You can use an alcohol swab to loosen the glue.
Nice nurse.
Yeah. If you have a patient with really thin skin, like an elderly patient or somebody that's on prednisone or steroids or something, you could, pulling these dressings, you can actually cause a skin tear. So you want to be kind of careful. You can use an alcohol swab to pull it up. The other thing you can do is hand sanitizer. You can just get a big old glob of hand sanitizer, just smear it all on there, leave it for a couple minutes, talk to the patient, do some other stuff, and the solvent will just pretty much pull the dressing will slide right off usually. So pull your dressing up. You don't have to worry about getting it all the way clean. You can just stick it to the catheter itself, and then you pull it straight out. Have your 2x2 ready. Pull it out like that. Apply pressure. If a patient's on blood thinners, heparin, Coumadin, anything like that, you want to hold for a few seconds because these will leak. And sometimes you'll like hold it for a few, for a little bit, and you'll be like, all right, that's good. And then you'll like turn your back, and you'll come back a minute later, and there'll be like blood everywhere. So you really want to watch that. The other thing you can do is Coban. That's the little wrap. If somebody's on blood thinner, usually I'll put a wrap or two of Coban just to put some pressure on it. But usually if somebody's not on blood thinners, it'll seal up within 10 or 20 seconds. When you throw this thing away, what you're looking for is that the catheter tip is intact. I've never seen a catheter tip not be intact. But when you chart taking out the IV, to say IV, DC, catheter tip intact, site within normal limits. For this, you just throw this whole thing in the sharps container. And for this, what we're going to do is save this piece